Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Well, welcome to Relationships Inside Out, where today we're going to talk about compassion fatigue.
Compassion fatigue doesn't just impact therapists or helping professions, but can impact anybody.
Yeah. And it's a psychological and physical exhaustion from exerting empathy on a very persistent, consistent level. It's when you're asked to provide authentic, genuine empathy and compassion on a regular basis.
That can have elements of physical support, right? If someone is disabled for one reason or another and you're making meals, getting water, physical assistance, but it's more than that.
Yeah. Yeah. You see it in a lot of helping professions. Anywhere you think about somebody has to consistently give empathy or compassion, which is a lot. And it's not just being polite, right? This is a complex, like neuropsychological process of being very like authentic and attuned, and you have to be present. Hence, when you're compassion fatigue, you're exhausted and your ability to give compassion is less. You might be more emotionally numb. You notice yourself
More irritable.
That one's a big one for me.
Right. Because my bandwidth is small. So thus my body doesn't cope well. Compassion fatigue, as therapists, we run that risk, right? Because we are hearing about people's worst days every day. We are hearing about people's challenges. Yes, good things. And we have to be really mindful of compassion fatigue for ourselves.
And there's a great book called Compassionomics.
I haven't heard of it.
I read it at UCSD, and it talks a lot about the research around compassion and how beneficial, because even giving compassion to others is beneficial for yourself. Right. So they were trying to enhance compassion in providers. It's very hard because when you're fatigued, it's really important because it benefits the patient or client, depending on the setting, and yourself because you feel better for doing it. But it's really hard when you're constantly doing it and you have other things that are impacting it, because not only can your work impact it, right? You could have stress outside of it. You could have a history of trauma. So your ability to like regulate and cope with stress is less. So then, you're not able to give compassion as much. There's other things that affect it, along with just exerting a lot of it all the time.
And it can be more based on a person or just in general. Example, if I'm giving a lot of care to the same person on repeat, I might experience compassion fatigue for them and thus don't want to listen to what they're going through, don't want to offer support, but still be able to do that for someone else. Right. So that is more centralized to that particular relationship, but it can also be generalized where I'm just feeling worn down. I'm feeling like my bandwidth is low, my energy is low, and thus I'm in that fatigued state.
And also I've noticed that, like, for example, as a therapist, you're able to give compassion to your clients. You're able to do that. Then there's not much left for the family.
Yes.
So there's that too.
Which is so hard.
Very hard.
And balancing, right? I tell my clients, whenever I book a new client, I'm clear about I take a trip every single quarter of the year, if not more often, for at least a week. That's not common in our field. I wish it was, but that's how I can combat it for myself, because I have to have breaks where I sleep.
Yeah.
Where I don't even work out during those breaks on purpose. I really let my body go into a rest state, but also then I can show up differently for my family, right? It's not just about for my clients.
Yeah. Now you're talking about kind of remedies, right? Self-care is a big one. I mean, it's probably the biggest one if we're not coping well. So that's another thing, is like, if you have, like I said before, the stress outside of, say, your clients or something like that, that could impact it. But also if you're just not taking care of yourself, eating healthy, exercising, boundaries.
Surrounding ourselves with the not best type of people, right? If we have people in our lives where they are a constant drain on us, it makes that compassion fatigue so much worse.
And compassion fatigue is different than burnout, because burnout is kind of like pervasive, like work stress. Compassion fatigue is fatigue from the emotional cost of giving compassion on a greater degree or a more consistent level. So it's different in that sense, but you see some similarities though in the exhaustion stuff. Like with burnout, you see more like less motivation, lower motivation. But both of them share, like, you can be cynical, right? Become more emotionally numb with the compassion fatigue.
Irritable.
Yeah, there's just so many different factors to look in for ourselves, to be aware that we are, to know that we need to take care of ourselves, and question, like, how is it impacting our families and other people around us,
and acknowledging it. This idea that we're just supposed to push through it, much like burnout. No.
Just push through.
You have to acknowledge it and give it the care it needs. So let's talk about some symptoms for compassion fatigue. We've already covered some.
Mm-hmm.
Besides irritability, sometimes we'll see people with sadness, right? We can start to get kind of that vicarious trauma or vicarious reaction from what we're witnessing.
Yeah.
It looks like fatigue, not like, hey, I take a cat nap and I'm good kind of fatigue, like tired all day, really exhausted kind of fatigue to my core.
Yeah. And you'll notice it's difficult for you to put yourself in someone else's shoes.
Mm-hmm.
You'll see that it's like your ability is lessened. The emotional numbness is the big one, right? It's just becoming more numb. It's almost like protecting yourself. It's like it's like a natural response to trying to protect yourself.
Your cup is totally to the top. I don't have room anymore to take in more input. And that's a big one, right? Yeah. Numb. Mm-hmm.
The other thing with compassion fatigue to think about, like for me, is there's specific jobs where they don't have a choice to put boundaries up. We're talking earlier about remedies, and boundaries are a big one. Like for us in private practice, we can set our schedule and we can coordinate that. We have control.
It's a privilege.
There's a lot of people who don't, and not even just professions, I should say, like somebody who's taking care of a sick loved one, whether physical or mental. And you don't have a break. You don't have the capacity to write off your schedule in the same way that somebody like you and I could. And in that case, you got to think outside the box. Like, do I have the resources to bring somebody else in to help assist this while I take a break? Because what's interesting about this is if we're not taking care of ourselves and we're fatigued, then you're suffering, but then also the people you're interacting with are suffering.
True. Because we can't give quality care if I'm already worn out. I have nothing left to give. This is when we see caregivers that are less present, are kind of shutting down the other person, are not able to attune and really show, again, that compassion to the people in which they're supporting.
Yeah. And that's another sign, right? When you notice yourself not being present, because you have to be present, as I said earlier, to actually give compassion, not just like, oh, polite, thank you. It's like deeper, more intentional. And that being present is essential for that to even happen. And when you're numbed and have compassion fatigue, you're not there.
We don't think about how much energy is actually expended in giving compassion to other people. We think about energy as being expended when we do physical tasks, and that might be part of the compassion. But mental energy is just as important to be aware of as physical. How much energy am I giving in my brain space? Compassion can be a big sap on that, not necessarily in a bad way, but it is one you have to pay attention to, right? If it's constantly being drained from me, I've got to be aware of that.
Yeah. Yeah. And I think one for me in particular, I ruminate. That's another one that you see with compassion fatigue. You just ruminate about it looks like a little bit like anxiety in that case, but it's in the context of just being exhausted.
Rumination, for those who don't know, is this thinking about something on repeat. It's over and over, processing it essentially to death.
Yeah.
Right?
Yeah.
And it's not a process we can necessarily help, but there are tools to make it a little bit better.
Yeah. And the tough thing when any of these episodes we talk about is symptoms is there's so many overlaps. So a lot of it's just like kind of markers to think about for yourself. And then, because it's easy to go through like a book and look at symptoms and be like, I got that. But in all kind of reality is you're going to have some tendencies in certain things. And, and before even getting to compassion fatigue, there's even like a model that says there's compassion stress before that, where it's coming on. And so this is where you start looking for those flags of my capacity to empathize is less, right?
This can be, how do I say this? It can look like burnout. It can look like depression or parts of those.
And even anxiety with the rumination piece. Yeah.
And sometimes they're comorbid. They go together, right? We might have both. Or if I do have anxiety and depression, it can lead to compassion fatigue and vice versa.
Yeah.
So it does get kind of woven into this, what can be a messy. The words are escaping me. I think of like a blanket, right? And the way it's woven. It can look different for each person.
And importantly, it's okay to experience compassion fatigue. It means you're a caring person a lot of the time.
And you have capacity, because everyone has capacity.
Yeah. It's okay to have compassion fatigue. It's okay to, especially, and this is very tough for the clients that I've worked with, where it's them having compassion fatigue for a loved one, like their partner who's has like a terminal illness or things like that, where they know they're going to be leaving, and this anticipatory loss of quality of life with the relationship, even if, I mean, it's just, there's this compassion fatigue, and then they feel guilty that they can't give compassion. And then that causes other issues of like, being hard on themselves, beating themselves up because they're fatigued. And it's like, no, like this is just a natural process. I mean, hopefully we don't get there and we're taking care of ourselves. It tells me we need to take care of ourselves better, but this is going to happen, and it can happen.
I've heard clients say things like, their illness annoys me, or they're constant talking about their illness annoys me. That's a sign you're in this
cynicism.
realm.
You see cynicism. Yep.
Where on a cognitive level, that said person probably can't help what they're going through. And when we start to get to, here they go again, that's the cue.
Yeah.
Right? And in fact, there were probably 50 cues before that one. But that is part of it. And that is normal. That goes to that judgment piece, or that guilt piece you were just talking about. If you're feeling that, rather than turning it to, oh God, I'm such an asshole, I feel bad that I even think this, instead get curious about it, learn about it. It's your body telling you, your mind telling you, we're kind of reaching capacity here. We got to do something.
And because we're systems thinkers, as marriage family therapists, I always think about the person that, like in a relationship, right, where someone's taking care of a loved one, whether a child or the adult, is the person being taken care of, the amount of guilt that they feel for being a burden, because they see it in their loved one. And this is a tough one, because a lot of us just want to think about, do self-care, go do your stuff. And then the person who's the partner is like, I see this happening and I feel like I can't do anything because of this illness, or, whatever I have going on for myself, I can't control it. And, sometimes in some cases you can have conversations about, how can we do this? What can we do to give a break, if that capacity is there to have that conversation? What would that break look like? How can we relieve some of this stuff? Because quite frankly, you're not really effective there if you're in that state of compassion fatigue.
Another thing that I think about with compassion fatigue, and I'll use a personal example. Say my daughter scrapes her knee. On a day when I'm doing really well and I don't have that, I can love her and realize she's 5. No, she's 6. She's 6. And this is a big moment for her. Even if I don't think it's a big moment, it's a big moment for her. And I can join her in that. When I start to show compassion fatigue is when I look at it as trivial and nope, just brush it off. Right. When I think about my clients have way bigger stuff, or I've got way bigger stuff than a scraped knee, that is a good cue. So as parents, paying attention to, are you attuning to your child in the same way? Are you attuning to what would be little to us crises, but that are very big to them, right? They lost that toy, they ripped their paper, whatever. That's a good marker for me. So paying attention in your world for, how do you normally show up in compassion versus how are you showing up now?
Yeah. And often it's less, right? And another thing I was thinking about with providers, oh man, I lost it. It's so good. I know it was so good. Oh my gosh.
Greg, are you in compassion fatigue? Is your brain cloudy?
This is the tough one with providers. This is one sign that I see when I work with providers as my clients, is that they start comparing clients' problems in their mind on an unconscious level, that like, you know what, I have a couple who's going infidelity. You guys are just, this is trivial. This is trivial. And you start kind of
comparing.
Yeah, what's the word I'm looking for? Prioritizing the compassion a little bit. I think that's really where it's about, is like you're trying to, in a cynical way.
Because you only have so much to give, so I've got to give it to where it needs it.
Yeah. And so that is something I see come up a lot with providers, and having to be aware of, is like, it kind of got elicited when you talked about your daughter, and it's like, we do have different like perceptions of what's worse or not, especially with compassion fatigue. As a provider, we're trained to approach every single one like this is the most important thing for them. And when you're fatigued, that can be more difficult, and you start seeing like being cynical and like, this is just trivial or whatever.
Or the sentence, well, at least it's not.
Oh God, don't ever say that. Yeah.
At least it's not as bad as blah, blah, blah.
Oh,
that's a good cue. We've got compassion fatigue.
I don't know what's more invalidating than that.
Oof. It's like brutal.
When somebody's trying to express, and this is the thing, when somebody's talking about their issue and you're trying to give them compassion, but you're fatigued. And then we go into like, oh, well, I had it worse.
Or I thought you were going to say something worse than that.
Even though we feel like we're being nice, it's like a very bad form of compassion, a lazy form of compassion.
But going with that too, Compassion fatigue also shows up in, say someone's expressing where they're struggling, being like, oh yeah, me too. Or, well, let me tell you about myself. Some of it is lack of attunement, but some of it is because I'm so maxed out. Not only can I not hear you, but now I'm going to offload on you to try to get relief for myself, if that makes sense.
Yeah, no, absolutely. And as you're saying this, as we're talking about this, my mind goes to, as much as we want to put it on everything else, it is our responsibility to manage this.
Yep.
If we want to show up, it's our responsibility. As a provider, it's our responsibility. And I think about emotional boundaries being extremely important.
Say more about that.
So this is really setting up boundaries in places where you want to exert compassion. And you might have a lot of stress in your life or more things that are kind of requiring that compassion. And this is where you might have to, put boundaries up to that, whether that means cut your losses with some things or learn how to prioritize them better. But this is a very important one. I think about this with people who have multiple jobs where they have to exert compassion, like a professor with students, and then they're also in private practice. And it's like, where do you want to balance this? And then you also have kids,
I was saying the parenting piece.
So there's just so many different places in our life where we have to exert compassion, and just evaluating that and what's a priority for you and how can we at least have some relief in one of those areas, and whatever that looks like.
Whether it's planning and support, that respite care, or like as therapists, limiting the number of clients we see.
Yeah.
Right. One thing we think about is, am I providing as good a care to my last client as I am my first client of the day?
Yeah.
When you start to say no, because you're worn out, that's your moment. Right. But this shows up in all kinds of fields, not just therapists.
Yeah.
Or with parenting, or if I know that I'm taking care of this family member and I'm also parenting, I'm also going to work, where can I limit? Where can I offload or delegate to someone else?
And this is what I guess I'm just going to go and say it bothers me about the institutions around like agencies and hospitals is there's models of profit over patients.
100%.
And so us providers are just worked to the bone, and they're concerned about bedside manner. And I'm like, well, you should really be concerned about compassion fatigue, which is a product of the system you have developed that wants me to see so many patients in a day, which, in the therapy world, there's research that says after so many clients, there's actually you reduce effectiveness. And so I'm kind of hypothesizing that's similar. And that I feel sad for those that are in those situations where they're trapped in their institutions that don't care about that for them, because that is a problem. And this is where the self-care comes in. This is where you might have to find other areas in your life where you have to put emotional boundaries up.
And they're overworked, right? And then that's when burnout and compassion fatigue start to bleed together. The thing about both of these is they can have real ramifications on our mental and physical health.
Yeah.
It's not temporary. It's not like a day off will solve it. This is not one day to solve.
This is a maintenance thing. You might have to it's like kind of like running your car a little harder. You might have to put oil in there a little bit more.
And what worked before to reduce my compassion fatigue may not work now.
Yeah.
I have to be continually updating my tools, right? Maybe going on a run every morning worked for me.
Yeah.
Maybe it doesn't in this season of life. Maybe getting 8 hours was good enough before. Shoot, what if now it's 9? Being willing to reevaluate and update is important here.
In finding activities that don't require compassion, running, exercising, maybe don't involve yourself around friends or something that, have a lot of stress going on that use you as a sounding board. Finding activities where you can completely escape from that. That's why you talk about like the trips,
crafts.
Art. Yeah.
For me, this sounds so bad and I know it, but watching reality TV sometimes helps because
you have no compassion for them.
Then I'm like, at least it's not that, right? It sounds terrible. Or I gotta tune out and completely check out of my own energy space.
Oh, trash TV.
But doing stuff for myself is really important because we can't just always be giving. Giving is a wonderful quality, but there is a fine line. You cannot always be in the giving. Sometimes you have to receive or give to yourself.
One interesting barrier I've seen with clients is some of them care so much about others so they don't have to look at themselves.
Truth. Distraction.
So they experience compassion fatigue because their self-worth is dependent upon how much they take care of somebody else and how well they do. It's like a performance for them in their life. That's their barometer of whether they're good enough or not. And then they experience compassion fatigue. I don't know. You and I both work at the hospital in psychiatric care. I can't tell you how many people came in for that exact scenario.
100%.
Yeah. Not 100% of the people, but
yes,
100% you agree with me. Just so you guys know that 100% of them weren't there for that. But They happen so much. And that's just another area to look at is, am I engaging in compassion, getting fatigued because I'm afraid to work on myself? Like, what is the function of my compassion that I'm giving? And that's just something you might have to work with a therapist to uncover and think about and process of like, what is the role and the function of this?
And is it actually beneficial?
Yeah.
Compassion inherently can be beneficial, but there are those lines where we cross into, actually, it's not helpful.
At least to that level, or how we're
Sure.
using it. Yeah.
It's a tough line to walk. We think of compassion as a wholly good thing, and it is a good thing. That comes with the dark side that we have to pay attention to.
Yeah. Doesn't impair your ability to function because of how you're using it or how much you're using it.
What other tools or supports would you offer clients?
So one thing that I found that was helpful working in like the family medicine world and that stuff, where I was kind of part of the system, was having other groups with other people who are fatigued and sit around, and I'm just gonna be real bitch about it.
True.
Not clients or patients, but just bitch about the fatigue and get it out. That helped a lot to normalize it.
Not hold it all in.
Yeah. So finding a way to externalize that, that was really helpful. How about for you?
Daily self-care is a big one. We've kind of brushed on it, but I'm not talking once a month, once a week. I'm talking daily.
That is.
It doesn't have to be an hour every day. It could be 10 minutes, 15 minutes, whether it's meditating, reading your Bible, going for a jog. I don't care. And what works for me, we've said this before, what works for me is going to be different than what works for my husband, for you, for whomever. Yeah. Find what works for you and try to do it in solidarity. So by yourself, right? If I'm trying to take a bath and my kids are with me, I'm not actually taking a bath and relaxing. I'm paying attention to, are they jumping in the water? Are they playing over here? Whatever the things, right? Somewhere for me quiet. Otherwise, I'm distracting through sound.
Yeah. And I think the important distinction here is that we're not doing things that are distracting from having to give compassion. We're also doing things that we don't have to give compassion, but also are rejuvenating for us. Yes. That's really important, because it's easy to have compassion fatigue and then be like, oh, in between sessions, I'm going to grab a snack and go watch TV. Is that helpful for me? Probably not.
Probably not.
It's not helpful for my waistline. But thinking about things that, again, going back to what I said earlier, that don't require that you can escape and also rejuvenate. I love how you talk about meditation, because I love the 5, 4, 3, 2, 1 myself. I'll do that maybe like 10 times and just sit there.
Will you remind everyone what that is?
Yeah. So I go through 5 things you see around you, 4 things that you can physically feel around with your skin. That could be air, temperature, it could be your hair on your neck, it could be, phone on your ear if you're talking with someone. And then 3 things you hear, 2 things you smell, if you can. And if not, you can do taste, if that's one. And then the last one is like a deep breath, but it's a very specific way. A lot of the research points to 4 seconds in the nose, hold for 4 seconds, and then exhale like you're breathing out through a straw for 8. That's where box breathing. That's where a lot of the research points to that for that number. And when you do it enough, you can tell, you're like, yeah, that makes sense. And not breathing through your chest, right? As we breathe in, you want your belly to expand. The 360. So 360 below the diaphragm. Yeah. Do you explain what that is? Yeah. So your ribs, belly, back are all expanding like a balloon, but it's below your diaphragm. So your breast line. You want to get down into the bottom portion of the lungs. We don't tap into that part of the lungs except for in sleep or intentional meditation. And so really engaging the whole lung, which if you look up a diagram, the lungs are a majority of your back line. They are big organs. And so really engaging that whole 360 breath. Yeah. And I like it because it forces you to be present. And with compassion fatigue, our mind's not typically present, right? That's the antithesis of it. Because if we're compassion fatigue, we're not present. Or at least not present on ourselves. We might be present to someone else's needs. Yeah. And maybe that was the goal, right? Sure. That was the goal, but I felt flat. The other thing that's interesting, we talk about the mindfulness stuff, because when I was at UCSD, we were working on different small, brief mindfulness interventions that worked on senses that a provider could do in their job, where they didn't have to go like in a room and it'd be dark and breathe, right? They can the soap on the hand, mindful hand washing. So they just what's the temperature of it coming out on your hand, right? What's the foam? Is it foamy? Looking at it, smelling it, hopefully not tasting it, but does it get warmer as I rub? Being very, and you're doing that because you're putting your hand on the soap before you go into the patient room. A keyboard as you're typing notes, like the sound of the chair, like a lot of these things that can help
doorknobs.
Because that's the hardest thing for people to integrate into their life, is when it's so different than what their daily routine is. So if you put this in what they're already doing, it can be helpful.
Another piece would be nutritious eating. I don't mean you have to go on a diet. I mean, eat to nourish your body, right? I encourage people, when we talk about food stuff, don't ask, is this good or bad food? That's not helpful to anyone. But is this nourishing my body? For us to not feel fatigue on a physical and mental level, food plays a big part in that. Am I eating a lot of simple carbs and sugar and what doesn't feel so good for my body, right? Like I have a gluten intolerance. Am I eating things with gluten? Or am I choosing to eat things that are actually fueling my body, that are helping with healing? So protein, getting in some veggies, things of that nature.
And typically when we're stressed, our body craves
wants that quick high, craves the sugar.
In the carbs. Yeah.
Because we want that quick high.
Yeah.
But it's just that it's quick. We want complex carbs. We want things that our body has to work on a little bit.
And typically, like, and we're not dietitians or anything like that, or experts in this area. But stuff that we've learned through some of our experiences in hospitals and things like that is that, but typically is when somebody eats, like, that's what their body craves, they'll eat it and now they're full and there's no room for like any of the other healthier nutritional stuff. And you won't be getting like the fruits or vegetables. Or...
So just paying attention to that. How are you fueling your body? Are you getting enough water? Right? Research would support that for water, typically, now obviously talk to someone who's registered in this, but typically we're drinking number of ounces of half our body weight. So for 100 pounds, it'd be 50 ounces, right? Are we getting enough water? Are we getting enough movement?
Yeah.
Movement doesn't have to look like CrossFit. It can look like stretching, walking, yoga, all kinds of things.
And what you're kind of really pointing to is self-care can be physical. Which is part of the nutritional, which is part of the exercise. It doesn't have to just be mental, which like the mindfulness or
the whole system.
All of it.
All of it works together.
Yeah.
If we just treat one part of it, just the physical, just the mental, you're missing half the equation.
Yeah. Very, very tough, because I feel like it's hard to even be aware of it when we're in it. We just know we're cynical and things. So it actually takes the space for you to reflect on yourself and where you're at. And I think the first cue to think about is, are you just more fatigued than normal? And then start going down the rabbit hole there of like, well, am I able to give compassion the way that I am? Or, but it does take awareness, which is a hard thing, because awareness means being present, which is a hard thing to do when you're already fatigued.
And therapy can help with that.
Yeah.
Right. Therapy can help give some of these tools, help you process, because the line of this is acceptance. Right. If I'm in a caregiver role and I've taken that role on, part of it is accepting that vacations may be limited, that my world looks a little bit different than someone else. How do I accept that, but also build in these tools to help support in that acceptance?
Yeah.
Well, today we've talked about compassion fatigue and how challenging it can be. Whether you're in a job that taxes this on you, as a parent, a spouse, a loved one. As always, if anyone has any questions or topic suggestions, feel free to email us at relationshipsinsideout@gmail.com. Thanks for joining us.
Thanks.